Okay, instrument list, finally, video. Number 1 is a right angle. If you look at it, it's very clear that it makes a right angle. These also can come in long and short. You will use these a lot in open cases, vascular cases, cardiothoracic. But either way, it's a right angle. Number 2 is a coker. These also come in long and short. Your coker has got these teeth, and I'm trying to show you without it not messing up the focus, but has these teeth on the end. You can clearly see them. These would be a traumatic clamp because it's going to get a bite of the tissue and hold it up. Number 2 is a coker. Number 3 is a tonsil. Now, if you remember back to your week 1 list, it kind of looks like a Kelly. It kind of looks like your hemostat, but it's typically this length, so it's the same length as my hand. And right here at the box lock is shorter. So just think of a shorter area because you're going just right into the tonsil. So that's your tonsil. This is a Bonnie forceps, okay? I always keep the Bonnie straight by the way the grooves are here, but also your Bonnie has teeth. It's going to be a traumatic forceps. So that's a Bonnie. And this is a long DeBakey. Now, you had DeBakey on your last test. We'll use a long if we're doing an open belly case because we need to go deep into the abdomen. So this is a long DeBakey. All right, HemoClip pliers. So you have over here later in your pictures these clip racks, okay? So when you have HemoClip pliers, if the surgeon is using HemoClip pliers, they'll put this in here, they'll reach it down, they'll push it down, they'll get the clip out, you'll hand it to the surgeon, and then they'll clamp that artery or that vessel with the HemoClip plier. HemoClip pliers come in micro, medium, and large. I could not find all the sizes, but this is your micro, this is shorter, and then this is your large. So on the instrument quiz, you would say micro or large HemoClip plier, okay? Then we have the Jorgensen scissor, also known as a gallbladder scissor. These scissors are typically kind of long because we'll use them in an open case. We can use these also in GYN surgery. But the tips are curved, but they're very thick. So they're thick like your Mayo. They're a heavy-duty scissor, but they're nice and curved. That's your Jorgensen scissor. Then we have a long Metz. So this is the same Metz scissor you saw on the last list, but it's long, again, for open belly cases. This is a retractor. It is called a malleable. If you look at it, how nice and wavy it is. This malleable comes in different sizes. It can be bent and manipulated to whatever size or shape we need it for in the case. They use these a lot in abdominal cases. It's also called a ribbon, a malleable or a ribbon. Okay? Number 11 is an S retractor. Kind of speaks for itself. It's an S. They'll use these if they're going to retract back in an open belly case or in sometimes GYN, GU. Just depends on what pan they have and what they're retracting. Some other retractors. This is a Goulet. If you remember in your first list, you had a Parker. Kind of looks just like this, except your Parker was the same all the way through here. This one kind of bulges out a little bit here on the sides, so it's different. You will hear people use this interchangeably with the Parker, but this is the Parker. This is not a Parker. Also, your Goulet, this end on the bottom is bigger than the end on the top. This is a Goulet. This is a Baby Rich or a Baby Richardson. See, it's a little tiny guy. That's your Richardson, Baby Richardson. And this is a Richardson Eastman. Now, on the test, I would take Eastman or Richardson Eastman. If you see, it is a double-ended Rich. This end is larger than this end. So that's your Eastman. Then you have a Wheatlaner. This is a self-retaining retractor. If we put it in, it will hold it open right here. And then we push this button. If I can do it left-handed. We will push this. Let me put it this way. Left-handed, and then it closes. And that'll release that so you can close it. And I can't do it left-handed. But it's self-retaining. Okay. Other self-retaining is going to be your Gelpy. Your Gelpy has points. These are very, very, very sharp. Okay. So this is a Wheatlaner. It has like the little, almost looks like a W. And this is your Gelpy. Both are self-retaining. So now we're going to talk about some supplies. We have your Hema clips that go with your Hema clip appliers. These also come in various sizes. This is a Raytech. These come in a pack of 10. This has the radiopaque strip in it for us to detect it in an x-ray. A laparotomy sponge. Laparotomy sponge comes in a pack of 5. Then you have a laparotomy tape. It's the same thing as this one, but much more narrow. It's also called a vag tape because they use these a lot in vaginal cases. But again, this blue strip is radiopaque for us to be able to see it during an x-ray. Then you have KDs, Kittners, Peanuts. They're called multiple things. These will go on the end of a Kelly to do blunt dissection, or we can use them in ENT cases for smaller hemostatic agents for blood, stuff like that. Then you have your patties or cottonoids. We'll use these neurological sponges. These are used a lot in the brain. We'll put that gel foam on them and put them in the brain. These are Weck seals or eye spheres. So they're triangular shaped for the eyes or ophthalmic. And then I put your knife blades here. Here's your 10, 11, 15, and 20. Remember, if it starts with a 1, it goes on a 3 or a 7 handle. If it starts with a 2, it comes on a 4 handle. And then I've got 2 different types of Bovie tips. Now, there are multiple Bovie tips. This is just a regular Bovie tip. This is a long Bovie tip to use in open abdominal cases. You count these as a sharp item, and they go in your sharps zone. And then your Bovie is always going to come with a tip on it. This is a unprotected, just regular Bovie tip. You can have Teflon, you can have Colorado tips. Your preference card will have exactly what it needs to have on it. And then to clean the Bovie, because sometimes it gets charred with material, we'll have a scratch pad. This is just like almost like an emery board, a file, and you can clean off this tip. You can, if your protector's off of here, you can take this tip. Let's try and take it out and just scratch it on here and clean it off. Okay, good luck.